I'm just very pleased that Dr. Choma is here to present the results of her intramural grant that the Office of Research in the School of Nursing had awarded to her. And just thank you very much and take it away.
Great. Well, thank you. And I first want to thank my mentors as well. So thank you to Lori Theeke and Chris Thomas. Thank you both for being wonderful mentors on this because I think this would have been a lot harder and not have happened without your guidance. Thank you so much. Excited to present this information and these findings. So we've had a couple different iterations of this title. So this is a little bit shorter than I think what is listed in the actual lunch and learn for today. So we focus on sim-based training to advance pediatric firearm injury prevention. You'll hear me talk about that a lot today. And then we often will shorten that to firearm injury prevention as FIP. So really looking at that in nursing education. Can advance a slide, Haley. Great. So kind of looking at, I could spend a ton of information giving you all background and data on firearms in children, and that's not the goal for today. So just a little bit of background so you have an understanding of why we needed to do this project. So we look at gun violence as a public health emergency. It is currently the #1 cause of death overall in all children from ages 1 up through 19. We've seen a tremendous increase, and that number does not seem to be decreasing. There's been an 87% increase in firearm-related deaths in kids and children in the US, most recently Austin, Texas over the weekend. So unfortunately, I could never use the same PowerPoint presentation because these statistics keep replacing themselves. We also think about the risk for firearm injury prevention. It's related to social drivers of health. So it really is important, and it's heightened the populations that experience disparities. We absolutely see different numbers of firearm violence and injury in kids based upon zip code. So it's really critical that nurses, nursing students, nurses that are practicing, healthcare providers really have some understanding of gun violence and these risk disparities and how to even begin to address that. Next slide, please. So I'm a visual learner, and so I recently had the opportunity to present with someone else on this topic, and she used a slide and gave me permission to reuse it. But this is really, very staggering. Our trajectory right now is that we'll have more than 10,000 youth, ages 1 through 24, will die by firearms every year. So we think about statistically what that looks like. That's one entire full school bus every 2 days, just for kids dying from firearms. So we really have to think about how do we address, and that's kind of where this project came from. This pediatric firearm injury prevention is really thinking about public health and trying to address this public health issue. Next slide, please. Okay, so really getting into this project. So we looked at this gap in practice, and what we really looked at is that there's a training gap, right? There's health professions education at large, and specifically nursing education, healthcare education, but specifically focusing on nursing education. We don't have education on firearm injury prevention as a routine, right? This is definitely something that we don't have routinely provided for nurses. If you're in public health, if you're in medicine, and we have to think about that. So looking on this education on FIP, looking at the risk firearm and also education in general, it's absent. And so what we really thought about, the inaction is actually causing more harm, right? So this inaction on addressing pediatric firearm violence as part of curriculum in undergraduate nursing education really impedes the ability of nurses to be impactful, right? We're a trusted profession. We have a lot of community interaction. We have a lot of hospital interaction, bedside interaction, primary care interaction, urgent care. And so we have this opportunity to address this crisis through communication and education of families, but we need to be putting this into practice. And so we looked at this, kind of talked about it, and really looked at simulation as a possible way of affording experiential training to have these crucial conversations, to help our students have these crucial conversations with families and to start to develop some comfort. Next slide, please. Okay, so this purpose here, as we really got down to the nitty-gritty part of it, Lori and Chris really helped me kind of think about what do we really want to get out of this. And so we evaluated, it was a pilot study. We used SIN-based training in pediatric FIP for advocacy for pre-licensure nursing students. So we really aim to improve their knowledge, their confidence, and their comfort in addressing pediatric firearm safety. And we're going to talk about how we were able to do that kind of coming together. So we'll look at the framework next, please. Next slide. So harm reduction is something that we use, the framework that we use for this, but it's a really great framework to think about when you are talking about things that have inherent risk, right? So we can't, unless we get rid of firearms, which is not the goal right now, it's not what's happening. And, if we're not getting rid of firearms, how do we live with things that have inherent danger? And we've seen tremendous success with harm reduction, this framework, with motor vehicle accidents, right? So we used to have motor vehicle accidents as a whole were a really significant cause of death in children. And so we applied this harm reduction framework to motor vehicles and really saw significant decreases. So essentially, how do we live with something we know has danger? How do we make it safer? It's never going to be safe, but how do we make it safer? And so in healthcare, we think about primary care prevention, right? Our goal is to make, think about gun violence before the gun is fired. This is primary prevention. We don't want secondary prevention and tertiary, that secondary and tertiary care, because then we have, poor outcomes. Again, trying to focus on that primary prevention. And so we really focus on education, anticipatory guidance, and awareness with this multifaceted approach. And this, guiding framework really, again, kind of demonstrates the connection between pediatric firearms violence and firearm injury prevention health equity issues, and really kind of helps bridge how we can approach this in a meaningful and health equity driven way. Go to methods next, please. Okay, so here's kind of designs. We used a pre-test, post-test design. Our participants, they completed their demographic and knowledge surveys before simulation, and then 1 week after their simulation, they completed knowledge, confidence, and comfort surveys. It was a convenient sample at the VSTC campus of undergraduate nursing students. Inclusion criteria, so they have eligible participants were all pre-licensure nursing students enrolled in the fall of 2025. It could have been any of the four cohorts, first semester, second semester, third semester, and fourth semester. And I believe I have to look back, we had participation from all. Our desired sample size was about 30 students, and we came close. We had 28. So we did use incentives as part of the grant funding. And so this came in the form of gift cards. And so the students, after they completed the first round of surveys, received a $25 Amazon gift card. And then once they had completed everything, both sets of surveys, they received another $25 survey. And we did have 100% participation pre and post, which was great. We looked at the validity and reliability of the tools. So we used education as an intervention. We'll talk about that in the next couple of slides. We didn't have, that had not yet been established because this was a pilot study. However, the SET-M post-survey does have established validity and reliability. I can go into those details if anybody has any specific questions, but those have been well established. So having, as we continue to do iterations, can hopefully look at that. And then IRB determination submitted, and this project was deemed exempt. Go on to the next slide. And then time frame. We just finished the time frame for this project. So we ran this project March 1st, 2025 to February 28th, 2026. So just kind of finishing up and wrapping up, and really excited to present this information to you all, but it was a 1-year pilot grant. We did use SPSS to enter the data. And we also use SPSS to kind of analyze the data. Participants were de-identified using a randomly assigned number. And then once all the information was entered, the data was de-identified so that all data was able to remain confidential. And I think, and students, after that they had after they did their initial surveys, signed up for a follow-up survey as well. Okay, educational intervention. Where do we go from? How do we provide information? So we use simulation. We'll talk about why sim in a second. But we use a couple of different things. We use this video, which is 1 year old. Actually, I think I just saw this for the first time a year ago at the Northwell Health Gun Violence Conference, which is tomorrow. So it's been about a year. So the Ad Council created this video, and their whole idea is that agree to disagree. When we use that, it ends a conversation on gun violence. But when we have the conversation agree to agree, it starts one. And so the Ad Council video, it's about 3 minutes long. We showed this video to students. I'm happy to share any of this information at the end. This is a pretty powerful video, but just helping to bring people who are gun owners, not gun owners, all sorts of different ideas together to have a good conversation. And then we additionally use, next slide, please, Haley. This ask tip sheet. So this ask tip sheet, ask is asking saves kids, and it is an acronym to help families remember to have conversations about firearm storage when they take their child to a family or friend's house. And so when we ask, we think about if I'm going to take my child to another family's house, here's like a text blurb we could think about. Just like we would say, hey, my child knows how to swim, or they have a peanut allergy. What's the environment that they're playing in? We want to ask, hey, does the other family have any type of gun? If they do have one, is it locked up and unloaded? And is it ammunition kept separately? And so these are things we're trying to make, kind of create this educational awareness. And so through this tip sheet, helping to teach our students about the Ask campaign. And then we also find about the Ask campaign is there's a double bonus because when parents ask or, about the firearm storage practices in other families' houses, it also causes personal reflection for them to say, if I'm asking about these firearm safety, practices, how am I storing my own firearms? So it's this kind of self-reflection. This sheet also has some statistics, so it addresses our visual learners as well. So we have the video, we have this tip sheet that talks about statistics and firearms and kids. And then it helps to kind of demonstrate, how a gun lock cable is actually used, and then gives more information on how to find out about firearm safety behaviors in families and how to, best provide the information. So kind of giving our students just an introduction of ways to approach firearm safety education with families. Next slide, please. Okay, this part was fun. It was all fun, but this part was really fun to develop the sim. So this, for the simulation development, collaborated with Chris Thomas, our sim director. And then we really thought about how could we use, what it's like for, nursing students and nurses to work with families and talk with them. And so we use the School of Nursing sim template. And then we kind of developed an iteration and then kept tweaking it of a simulation on pediatric firearm violence. It's based upon literature and then some of my own experience as well. We use an SP, a standardized patient. When we made the call for the standardized patient, we kind of let them know that they'd be a parent. And so we did wind up having our standardized patient that we met with about 2 weeks prior to the simulation, went through the goals, went through the actual sim template, went through the objectives. And then what I wasn't expecting is how helpful that the SP was with giving feedback to the students as well. So that was this was kind of my aha moment. I know I can talk about that at the end, but through this method, in speaking with the SP, that was really very beneficial to kind of get their perspective. And so we're able to really, debrief with the SP the day of and then after the debrief. And some of the feedback that the SP was able to provide to the students was to really think about the parent's perspective or the caregiver, their point of view. So for example, we talked, the SP would say to the students, I really felt very comfortable when you went in as a whole and talked about firearm safety education after you had talked about, safety with swimming and safety around the house. I felt, and then she would have other conversations with other groups. where she would say, I felt a little caught off guard and uncomfortable when you talked with me about firearm safety education as soon as you walked in the door. So kind of helping them to develop that rapport. And then similar to how we run simulation at GW, we had we had about 10 students in each group, and we would have two of the students in the simulation group were the active participants, and the remaining approximately like 8 students would be the deliberate observers, where they would observe the sim through streaming and be able to kind of be involved with the simulation. And that's just the standardized form that we use at Sim as well, so kind of work together. Okay, next slide, please. Okay, so if we look at the results, there's just some of their demographics. So you can see this slide had about 25% of our participants identified as Asian, about 21% identify as Black or African American, 4% identified as Native Hawaiian or Pacific Islander, and the remaining 50% identified as white. Gender, we had about 18% that identified as male and 82% that identified as female. Next slide, please. And this is for pre-test, post-test. Okay, so this slide has a lot of information. Okay, so we had, you can see the pre is in blue, and the post is kind of like that gold. And so we asked several different questions that really looked at knowledge, confidence, and comfort. And so if we look at the slide, you can see that nobody, zero, that's why you see no blue, 100% had never heard of the Asking Saves Kids campaign at baseline. And then similarly, about 21%, only 21% were able to define it. So even though some had never heard of it, some were able to kind of guess and define it. However, on post-test, there was 100% awareness of the Asking Saves Kids campaign and 100% awareness and knowledge of what it actually was, correctly defining it. We look at knowledge of federal and state firearm policies. It rose, so at baseline is about 10.7% to almost 60%. We use McNamar's test, and knowledge of harm reduction model increased about 96%. And was statistically significant. So we talked about the harm reduction model that we talked about earlier and teaching students about that. That particular area was statistically significant. We also looked at knowledge and the role of healthcare providers in discussing firearm injury prevention. And so that rose slightly from about 60.7% to 96.4%. And using the same test on McNamar's, it was statistically significant. And then finally, we looked at confidence and comfort. So confidence in providing the education rose from 18% to 92.9%, with paired t-tests confirming the gains in understanding the injuries, explaining prevention strategies, and incorporating safety education into practice. And then comfort. So we talked about comfort in addressing culturally sensitive aspects of firearm ownership in families. And though it was not statistically significant, it was educationally meaningful. It rose from about 18% at baseline to about 75% after in post. So lots of information on the slide. I'm happy to go through this later, answer any other questions, but let's go to the next one. Okay, so what does this mean? So based upon this, our pre and post data, we are finding that simulation-based training, this experiential-based training, it's effective. It is helping our nurses or nursing students address pediatric firearm injury prevention, and that's exciting. Next page. Okay, so we think about this as a framework and really helping to equip our practice-ready nurses with knowledge, confidence, and experiential training to implement effective interventions that address pediatric FIP proactively and holistically. And then the idea would be to, create this curriculum and then potential for adoption. We're not the only, we should be including our, medical healthcare providers. We think about PT, we think about public health. So lots of other healthcare disciplines can adopt this and kind of bring this into training. Next slide, please. And so this information, this was a quantitative study, but there is an area on the validated tool of the SET-M that does have an area of qualitative response. And so this is just kind of thematically bridging these together. And so really looking at these crucial conversations, these students felt it was valuable, overall increased their awareness of the importance of providing patient education. A lot of the students qualitatively, again, reported the experience broadened their understanding, and many felt that they would never go back to not including this. Or, many felt like, wow, this is this big aha moment. How could I not? Now that I know this, why have I not had this? And I will definitely include this in future patient interactions. And so this was really helpful as an exploratory learning process as well as thinking about kind of see one, teach one, do one. And so hopefully these students will be able to take this away after they've had this experience. All right, next slide, please. So conclusion, we should probably repeat this with a larger sample size. We could think about grad students and other healthcare disciplines, and we certainly have had interest from local hospitals, like think about Children's and Fairfax, to help train healthcare teams. And our last slide, we talk about our dissemination and findings. So we are set to present at a couple of different places as different areas. So we will be presenting at SABR in April as a poster presentation. We'll be presenting at NLN in September as a podium presentation. We are hoping next steps would be to go ahead and try to publish results of this and then publish experiences with this. Definitely, one of our great discussions and kind of that I just had recently with Chris and Lori was looking at future grant funding to further develop simulations, looking at the NLN, Children's National. And then really my goal, like long-term is, with this grant funding is to develop a curriculum for students in healthcare providers that we can use for both the learner and for the practicing providers in healthcare. So I'm going to leave you with this and then open to any questions. So we have 73.6 million children living in the US currently, which is 73.6 million reasons for all of us to get involved as nurses and healthcare providers. And we have the capacity to connect with families and communities. We know how to reach these populations. It's a really valuable tool and we have the access. So goal would be to go ahead and harness that access. I have my references and a huge, again, thank you to Lori and to Chris. You guys have been tremendous and so instrumental. So thank you. Questions or anything Chris or Lori want to add?
No, I mean, I would just say it's been a real pleasure and I'm looking forward to our future work. And I just sent you drafts. I sent you edits on the poster just now, right before this meeting. So
Fantastic.
we are going to keep moving forward with this. I think we can really make a difference in the lives of these children and actually in nursing education. So I thought it was great. Yeah.
Yeah. Kudos to you, Betsy. There was a lot of work behind it, putting it together, training the SP so that the students had a really great experience. All your knowledge and background was really, I think, instrumental in that. Nice job.
Thank you. Haley, am I taking questions or you? I'm happy to do either.
We have some hands raised. So Joyce.
I just want to thank you very much for this valuable work. As many of you know, I live in the Second Amendment country of the world. Lori's getting a little smile there because she knows what I'm talking about. So this is really, really valuable to help keep children safe. And I really appreciate the work that you've done on this because it's really hard to start conversations with people about guns, particularly around here where my own cousin had an open loaded firearm hanging on a wall and his 4-year-old took it down and was walking around pointing it at people.
Wow. Thank you for sharing that. Thank you, Joyce.
Thank you. Jennifer.
Thank you, Dr. Choma. This is fabulous. And I know it's so passionate for you and so important. I think what's even more important, it's not just the children that this can save, but also all of the, all of the harms to the survivors, to the first responders, to the witnesses. I see tremendous trickle, like ripple effect of this type of education and preventing. And we've got, those of us that work in pediatrics know that even things as, active shooter drills in school can be quite impactful on children's mental health. And I've got quite a few patients I'm working with right now that are all victims of firearms, just as witnesses. And it's just so disheartening to know that we can prevent this. And so I think that this is fabulous, and really hope that you continue it, because I think it's going to help a lot of people. Thank you.
Thank you. And Dr. Walsh, I'll send you, there was a really good article that Dr. Song had done that really talked about exactly what you're talking about, like the mental health repercussions of costs, like how that's all, what are additional things kind of put together. But you bring up really good points.
That's great. Do we have Arlene?
Yeah.
Yes, sorry, for some reason I couldn't get my hand up. Anyhow, yeah, thank you, Betsy. This was fabulous. I would love to have further conversations how we can collaborate with our NP program and get this simulation in our NP program. I think it's wonderful. I was definitely kind of shocked when you this is a real problem, but aspect that just hit me with this presentation.
You're breaking up
Thank
a
you so
little bit.
much, and I look forward to further working with you. Betsy, in F, am I breaking up? Can you hear me
Yeah, I think
now?
we lost you a little bit, Arlene.
Okay.
But we can hear you now.
That's strange. Okay, well, I apologize about that. I just wanted to thank Betsy for her presentation, and she has worked with me with the FNP students, and we have some of firearm prevention in our courses, but I'd love to work with her further to get this simulation in our NP program. So thank you.
Yeah.
Did you hear what I said?
Yeah.
Yes, we heard
Thank
you
you.
early. And the other thing I want
Okay,
to say on
good.
the other thing I'd like to say on the research lunch and learn, because a lot of people might not know, but kudos to Betsy, because, we spent about 6 months, Betsy and I and a whole team from the law school and public health, working on an R25 that was an entire scholar program for a summer on gun violence. And we submitted that application, and it was due to be discussed when the new administration came into office. And January 17th, it was to be discussed, and we were super duper excited. And we had like the dean, Adnan Hyder, we had a bunch of people on this grant around GW. And it was a tremendous amount of work to put that team together. And all of a sudden, we looked up and the call was just eliminated. The grant was never discussed, and the funding was not going to come. And so, like, kudos, I think, to Betsy and our team. Really, the team pivoted, and we said, okay, we're going to start small. And thank you, Dr. Pence, like, for internal funding like this, to take a small grant and just keep pushing and be persistent and get started on something. I mean, that's like the life of a researcher that's wanting to build something tremendous. And so knowing when to pivot and what you can get and what you can't get, and sort of reacting to it, but then turning around and finding some other funding so that you can keep moving forward. And so I want to say good job on that, Betsy. Like, we just pivoted and said, what can we get now? And what can we do now? I think we have tremendous ideas of where this could go. But, we had to make that quick change. And will continue to look. Like, the R25, I thought, was really well developed and would be something the School of Nursing could lead on. And it was a summer scholar program on gun violence for nurses. And it was really, really, I thought, really strong. And so, we can take another look at that. We've lost some teammates. They've left GW, but it's still something to consider for the future. And so I think I just wanted to say that like, this was a real pivot, this study for Betsy, and still she made a success of it. Yeah.
Thank you, Lori. And again, Chris, thank you for the opportunity. I mean, the intramural funding was huge, so thank you for that part as well.
Yeah, absolutely. And I'll just second that, that's what we hope comes from the intramural funding, is that, it gives you a place to start collecting your data, and then you're able to take it from there and go to the next level, like I know you're going to, Betsy, and secure extramural funding or whatever the next steps are. So it's been wonderful to work with you. And when the next call for intramural funding comes out in the summer, probably, we hope that whoever is on this call will consider that as well.
And thank you, Haley. Yeah, you've definitely answered many of my questions, offered a lot of guidance. So thank you very much as well, Haley.
Of course.
Yeah. So, and thank you everyone for being here. I think I would just ask that all of you share your experience with, listening to the research that's being done in our school and encourage your colleagues to attend our our sessions because it would have been nice to have more people here. I know that people are teaching and things like that, but at the same time, I think that we really can learn from each other, and these are like potential future collaborators that you could be working with. And I just, I think it's interesting because this is such an important topic. I remember when I learned pediatrics in 1994, I think I was taking my pediatric class for my FNP program. We were supposed to ask every single parent, about guns and whether they were secured. And then all of a sudden, this was like something that we're not allowed to ask as healthcare providers. So to me, it's really shocking. Like we still can, I guess, ask about seatbelts, but we can't ask about guns. And then the other piece, which I think people need to really understand, is that just this week that father of the boy was convicted of murder because he gave his child access to a gun. So this is beyond your Second Amendment rights, I think. People are putting themselves into jeopardy.
Yeah, Chris,
So,
there's so many. Yeah, I won't take up any more time, but there's so many interesting. I'll send you some studies. A lot of
Mhm.
interesting, like based upon the state, based upon the laws, lower
Yes.
incidence of injury. And I'll send you
Yeah.
all the Northwell link for tomorrow too.
Yeah, thank you. I know that Rick, mentioned that yes, it varies from state to state, and that there are some states where you're not even allowed to ask these questions. So, all right. Well, if there are no other questions, thank you so much for attending, and we'll see you at our next luncheon.
Thank you for your support, everyone. I appreciate it.